Have you ever stood up from your bed and you suddenly felt dizzy, or you felt like the entire room is spinning and you had to quickly grab a seat to sit down so that you don't fall? You might be experiencing what we call orthostatic hypotension. Hi guys, welcome back to this channel. This is Dr. Asiya. As usual, I will be breaking down common health conditions that we face. So today I'll be talking about what orthostatic hypotension is, why it happens, who is at risk, and what you can do about it. Orthostatic hypotension, also called postural hypotension, is when there is a sudden drop in your BP after standing from a seated position or from a laying position. What happens is when you stand up, gravity actually pulls blood to your leg, and then your body compensates for this by increasing your heart rate and tightening of blood vessels. And during this short period, the blood does not quickly reaches the brain. So your body tries to adjust to this immediately and rectify it, and then you have this symptom of dizziness or wanting to faint. But within few seconds of you just sitting back down, it adjusts by itself. And then blood reaches the brain and the blood pressure goes back to normal. The symptoms that you might experience might be dizziness, weakness, confusion, blurry vision, headaches, or even fainting spell. Some people actually faint and have a fall, but within a minute or two, it gets better. Most people say they experience this, especially in the morning when they just wake up from sleep. Orthostatic hypertension can actually affect anybody, but it affects people above 40 the more. And it also affects people that have been on bed rest for a very long time, people with diabetes, or pregnant women, or people who just delivered, people who are dehydrated, people who are also on high blood pressure medications. It can also happen to them. Several things can trigger it: dehydration, anemia, or blood loss, prolonged standing. In fact, even skipping your meals can also trigger it. Severe infections like maybe sepsis can also trigger that. If any of these symptoms happen occasionally and it's just for brief periods, then there is no cause for alarm. But if it's repetitive and it's been going on for a prolonged period of time, then you might need to actually see your healthcare professional and make a complaint. How do we diagnose this? So when you see a healthcare professional, your doctor will check your BP readings while you are laying down or while you are also seated. There is also a test called the tilt table test, where you will lay down on a table and the table will slowly bring you up to a standing position. And then your BP readings will be checked. Then blood test to check for anemia. Anemia can be due to iron deficiency, meaning if you have low iron in your body, or due to vitamin B12 deficiency. Those two things can actually cause anemia, and anemia can actually make you to feel like that when you actually stand up from a sitting position or a laying position. Echocardiogram can also be done, which is to see how your heart pumps blood and how your heart regulates itself to check for any defects. Here are some practical ways to actually manage the symptoms of this. When you wake up from sleep or you want to rise from a seated position, try to stand up slowly. Drink plenty of fluids because dehydration is also a risk factor. If you are pregnant and you know that you're going to be on bed rest for a long period of time, or you just delivered maybe through cesarean section, it's advisable to wear compression stockings to help with the flow of blood from the legs back to the heart. Exercise regularly. If your job requires you to actually stand for a long period of time, I would recommend getting a compression stockings, or try to be moving your legs at interval while you're standing. If you're hypertensive, always go for follow-ups so that you can discuss with your doctor if there is anything to change in your medications. If it's your medication causing you that, they can always make some adjustments. Orthostatic hypertension is often manageable once the cause has been identified. If the dizziness is frequent, worsening, associated with chest pain, shortness of breath, fainting spells, it is highly advisable to actually see a healthcare professional so it can be duly managed. If you've ever stood up and seen stars, comment me below and you know that you're not alone. Stay tuned for the next video and Don't forget to like, subscribe, and share this video. See you in the next one.